And you're live.
Hey you guys, sorry, let me do that again. Hey you guys, I'm going through puberty, Dr. Emer, and we're treating a patient of mine here that has what's called a Nevus of Ota. This is a very specialized birthmark that has very deep pigmentation. You can see all through, it can even go into her eye and around the head over here. Luckily, we can do laser tattoo removal. You have to pre-treat with peels. And she has an eye shield in, so I can actually go over her eyelid. I'm going to show you guys here. Turn the knee just a little bit. Right there, perfect. I'm going to show you guys here. We're using what's called a Perfluorodecalin patch. We use this to make it so we can do more treatments. She has a metal shield on the inside of her eye so that we can treat her whole lid. And you guys can see what's happening right now is the laser specifically targeting the the deeper surface. Okay. Perfect. And so we do one pass, and you can see a lot of these areas have darkened. Perfect. And now what I'm going to do is switch now. Hold on one second. Need. There we go. Have to switch to this goggle. I'm going to switch now. First we did a YAG laser. That goes deeper. Now we're going to go to the surface. Now the first treatment or two that we do, we have to be a little bit more cautious with how we treat it. So what we're gonna do, you guys can see it's already responsive. Look at the darkening in that area. All that pigment darkening is very good. That means it's responsive to the tattoo removal. So now we're gonna switch the device. We're gonna get the gel that's on there is gonna help dissolve some of the oxidation. And we're gonna put the patch on again. And we're gonna use the patch now using a different wavelength. This is more superficially targeted. That's telling me new wavelength. So this is more superficially targeted, meaning that those with darker skin types, so we're going to start here. Those with darker skin types, even their superficial pigment can be attacked, so you have to be really careful with post-care. It's very important. Let me take a look now. Very good. Let's go to these darker areas.
Is this laser good for freckles?
No, this is for specifically birthmarks. You can do it for sunspots. Look at what happens, you guys. You see that whitening? You see that frost? It's great. See that frost? All that means is that the pigment's breaking up into little particles. You can use it for sunspots. Freckles always come back though. Look at that. See that frosting? Mm-hmm. That's great. Now she has an eye shield, a metal shield inside. Otherwise you couldn't treat her upper lid. This is going to be life-changing for her. I'm super excited. It's going to take us probably 6 treatments or so, maybe a little less. We'll see. Okay, so now if I show you guys, I'll take a look really quick. You guys can see, look, how responsive. Hey, boss. Look at how responsive it is over here, too. That's great. Almost done. I'm going to move the patch now to this top portion. Each time we do this, more and more of the pigment goes. And then eventually it clears. Now there's a chance they can come back, so we can do touch-up treatments if needed. Turn straight. Perfect. She was very nervous. How are you feeling right now?
I'm nervous.
You're nervous, but you're okay.
Yeah,
Okay,
I'm
good.
happy.
Good. Turn to me again. A little bit. Move our patch a sec. Perfect. Press me hold here, please. Make sure that's. There we go. We're using a ruby, which is not many people have this laser. This is the ruby laser. It's very specific to superficial parts of the skin. Perfect. So that is it, you guys. I'm going to do a little dry off spot. I'm going to highlight separately. But look, overall, every area that she had that birthmark, look at it. It's inflamed, it's responsive. There's a little up here that will treat. But other than that, everything went well. And you'll follow along. She'll send us pictures as time goes on the treatment of this birthmark using a tattoo laser. Bye, guys.